Again, we are getting our information from our Kankakee County Health Department, Riverside Healthcare, and Amita St. Mary's. And that reminds me that I need to give a shout out to Rebecca Parks from Riverside Healthcare because she was instrumental in helping us coordinate our special guests today. So as of today, the state of Illinois has confirmed 25,733 cases of COVID-19, and that is throughout more than 80 counties. And as I've mentioned before, the state of Illinois has 102 counties. So as this has progressed over several weeks, it is spreading throughout the entire state of Illinois. We've had 1,072 deaths in our state, and more locally here in the county, we've had 265 confirmed cases of COVID-19 with 13 deaths. We have had 47 recoveries, and I've started reporting on recoveries because I want people to know that not everyone passes away from COVID-19. And the other reason I want to share that number is because we have went into a shelter-in-place order under the governor and also in the city of Kankakee, and the efforts that we are making to social distance are having an impact in terms of how this disease continues to spread. So we have to continue doing the things that we've been doing that are working. So at this time, I'll go ahead and introduce, or have our guest introduce himself, Dr. Khisty. Tell us a little bit about yourself, maybe where you grew up and where you went to college.
Sure, absolutely. So I'm originally from India, if you guys can tell, and I was born and raised there. I completed medical school in India. However, I did my psychiatry residency training in North Carolina at Wake Forest Baptist Hospital. And I stayed back and I did a fellowship in child and adolescent psychiatry there.
Okay. And what made you pursue child and adolescent psychiatry? What sparked your interest about that particular area of study?
So that's a very good question. I think people who have mental illness are already vulnerable, and on top of that, children are vulnerable to begin with. So it's almost like a double whammy, having a mental illness and being a child. And so I really wanted to work with the most vulnerable population available. And, I'm like a big kid myself, so I think we just hit it off.
Okay. And we definitely need more professionals to work with children. If you can just adjust your mic a little bit.
Okay. Is this better?
All right. Everyone copes with stressful situations differently. Who might respond strongly to the stress of something like the COVID-19 outbreak?
I think this is an unprecedented situation. I think this is a pandemic that we've never experienced ever before. And so our most vulnerable populations are the elderly.
And can you tell us why?
Because the elderly are at a higher risk of contracting COVID-19. And so I think that is the most obvious risk factor that we have currently. In addition to that, I think some of our elderly populations have more comorbidities, more medical conditions that make them more susceptible to developing COVID. Also, as you grow older, your social support starts dwindling down. People may lose a spouse, they may lose their children, or their children have left the home. So there's a loss of that social support network that elderly folks have. And I think that really makes them more susceptible. The other susceptible population are, of course, children. This is completely out of their normal schedule. Schools are closed, they cannot meet their friends, they cannot run outside. So it's very stressful for children because they don't know what's happening, in a sense.
What may be triggering stress, anxiety, or depression? I know that a lot of people in the community, particularly our business owners, have expressed a lot of concern around not being able to operate if they're not considered essential under the governor's order. So, when you look at the ability to work, the ability to provide, to sustain your family's income, what are some things that you see that are triggering to stress, anxiety, and depression?
So let's cut it down by age group. I think that would be better. When it comes to children, of course, like we spoke about, their loss of their normal routine, not being able to meet their friends, just the day-to-day activities, that is pretty hard on children, and that is very stressful for them. And even adolescents, especially adolescents who are graduating high school. What happens to their college applications if they are applying to college? Now, most schools are not even having campus tours. And so that is an additional stressor. Or there are certain cases that I've heard where children have been accepted to colleges as their first choice, maybe in a hotspot zone like in Chicago, or if you got accepted to a college in California, what happens now? You know, there are hotbeds of COVID-19 currently. And so that is very stressful on not only adolescents, but also their families. Now, when we go to adults, like you spoke about, you know, loss of employment, that is a big, big trigger. I mean, the financial insecurity, what do you do with your mortgage? What do you do with your car payment? And just some of those things are very overwhelming, and they can definitely lead to more depressive symptoms.
You know, you mentioned the loss of structure. I was just speaking with my husband the other night. One of the things I like about being the mayor is my flexibility. You know, my schedule, you know, I can work it till 8 at night if I want. I can come in, you know, at 9:30 in the morning if I want. But for me, you know, because of this, I think a lot of us are getting more lax in our schedules at home. And I was just telling my husband, I really need structure. Like, I feel like I really need to not be staying up till 1 o'clock in the morning. I just need to have some type of routine. So if I'm feeling like that as an adult, I can only imagine how it's impacting children.
Absolutely. I mean, they cannot meet their favorite teacher every morning when they go to school because now school is closed. Yes, we have more video online schooling currently in the situation, but it's not the same. They are not used to this new format. And so what we recommend is having a structure at home. But for all you parents out there, I empathize. That's hard to do with children.
Especially when you're trying to still work. Absolutely. As a parent. I have a friend that's a mayor in Norman, Oklahoma, Mayor Clark, and she's considered a part-time mayor, although I think most of us who have towns of a decent size don't work part-time. But she has 2 children under the age of 10, so she's trying to be the mayor of her town plus work. She's an attorney, and then try to make sure that her kids are, you know, stay up to date on all their assignments with school. And she shared with some of us that she has one that, you know, has some extra, that needs some extra help with homework and that type of thing, and had a really good kindergarten teacher this year, and had a great relationship and just worked really well, and now that's been disrupted. So, you know, it's a big change, and we need to really thank our teachers as well. This all happened so suddenly. We none of us have had a test run of doing this, and so our teachers really are to be commended for how quickly they had to adapt and adjust. And I know there are some teachers that are calling, you know, their students to check in with them and that type of thing. So, okay. You want to make sure your mic is.
Okay, one more time. Okay, I'm just going to put it to my tie. That better?
Much better. Thank you.
Thanks.
So what are some concerning changes in habits or moods to be aware of during this pandemic and time of quarantine? What are some of the things we should be watching for?
Really, I think during this pandemic, everyone's schedules are kind of off. But if that schedule is so out of sync, that's what our biggest warning sign is. The most important is sleeping too much or sleeping way too little, to the point where it's affecting their everyday functioning. If you're unable to provide for your daily needs, like activities of daily living, like bathing, cooking, or cleaning up, I mean, just some of those things that are completely out of norm for you, those are big warning signs. Like I'm going to be the first to admit, right? I'm not a big cleaner, but that is the norm for me. So if it is out of the norm for you, I think that's really a big warning sign in this current situation. Of course, feelings of hopelessness, helplessness, worthlessness, feeling that, you just don't want to wake up ever or start having actual thoughts of wanting to kill yourself. Those are red flags that you really want to seek help for.
And we said changes in mood. We were joking at the office the other day. Most of us, when we go to college, we worry about the freshman 15. And I said, I think this is the Corona 25 because a lot of people are doing a lot more cooking and eating. And so would you view that as an indicator that maybe something is wrong in terms of appetite?
So in terms of appetite, well, we are all sitting at home and not exercising, right? So if I just look at appetite in and of itself, probably not, but in the entire context of things, right? If your mood is off, if you're not sleeping well, if you're not taking care of your kids, and your appetite is a little bit different, yes. I mean, in that context, absolutely we would worry about it.
And that's one thing that you mentioned, that people aren't exercising. People can leave their house.
Yes, they absolutely can.
People, we are on a shelter-in-place order. We want people to only leave when they have to get those necessities, like their groceries or their medications. But it's okay to take a walk. We encourage that. I've been encouraging that doing my weekly videos for people to get outside and get some fresh air, especially since the sun is shining. We had snow this week.
Yes.
But the sun is out and, the air is crisp, and I think it's really a good idea, even if you can just sit on your porch or get out and take a walk, ride a bike. It's okay to do that. We just don't want people congregating. So we don't want basketball games and tennis games and things that, contact or sharing of equipment and going back and forth. But we do want people to still try to exercise, to take a walk, to walk your dog. It's totally okay to do that.
Absolutely, and I think there are so many things that people can do at home. There are the other day I put on a YouTube Zumba video in my own basement, right? Even if you don't want to go out or are feeling anxious about going out, there are a lot of online free resources that people can use to actually maintain physical activity while they're in the home.
That's a great idea. And someone told me about yoga too, that there's some yoga videos that people can pull up online and do yoga in their own home as well. So just a couple of tips for people out there. I'm going to check and see if we have any questions. Anthea says that she was just speaking to a junior high student who is having a difficult time adjusting to this pandemic. So junior high age, we're probably talking about 12, 13 years old. Yep. What would you suggest, Doctor?
I think the most important thing for their parents or guardians to know is to, number one, reassure. I think that's very important for children to see that their family members are calm and are reassuring. The other most important thing to let your child know is let them know the facts. Let them know what's going on in an age-appropriate manner. And a lot of times we will see preteens or teenagers come and ask you the same question over and over again. And it's okay. Just be patient and answer again. A lot of times that is their way of seeking reassurance. What really is worrisome in children is if they start displaying physical aggression, or if they start mentioning that they want to die or they want to kill themselves. That is when you want to seek help. Okay. A lot of times children will be anxious about what's going on. And so it's like the mayor said, right? It's okay to let them know, people are recovering. Just being contracted, or if you contract COVID doesn't mean you're going to die.
We had another comment. Cara says, thank you for the updates. Mental health is an incredible, important topic. Yes, it is all the time, not just during a pandemic. Our mental health is very important. Thank you for tuning in, Cara. Kathleen says, what about eating when you're not hungry? And probably 85% of the population is guilty of this when we're not in a pandemic.
Absolutely.
And we know people eat when they're not hungry for a variety of reasons, but I'll have you address that.
Yes, and I think that could be part of boredom, right? A lot of people will eat when they're bored. A lot of people will eat when they're stressed. And so there are other ways or techniques that people can use, like we discussed some physical activity in the home, or even engaging in other creative ideas that you probably wouldn't have, right? Family game night is probably a great idea. How many years has it been since you played a board game? And that is a good way to spend quality time while at the same time not engaging in some of those behaviors that you really don't want to engage in. For all the animal lovers, I'm a dog lover myself. Your pets are probably very happy that you're at home. Spend some more extra time with them. I think those are, if you are a spiritual or religious person, prayer and meditation are extremely powerful, especially in times of crisis like this. I think people underestimate the power of what faith or spirituality has, and I think that's something that people can also absolutely tap into. The other thing is, if you truly do want to eat, celery sticks and hummus really are not going to cause you to gain a lot of weight. So sure, have at it.
So the choice of food.
Choice of food is very important, yes.
One of the things you mentioned, and I would like to commend our community, the city of Kankakee residents. I think most of us do have some type of spiritual connection. And so I had started doing some video updates on Sunday, and I actually pray with the community during the video update. And I know a lot of people have appreciated that and expressed that they feel better about it too, to know
Right.
that not only are they praying, but that their leaders in the community are also praying. So
Absolutely.
I think that's a very good thing that we need to tap into, especially during this time.
Absolutely, and I think us as medical professionals are guilty about this, where people or medical professionals generally hesitate to talk about religion or praying or spirituality. But I think it's good to acknowledge that spirituality is a big component of people's lives.
Yes.
And it's a very big protective factor for people. People have whatever faith they are in, their faith community is a big source of support, especially during times like this.
Absolutely. And it's also okay if people do not
Absolutely.
choose
Absolutely.
to participate in, faith type activities or practices. We always make that clear as
Yep.
well. But
Absolutely.
I will say it has been something that has helped me a lot during this time. And I think it's something that's helped our community as well during this time. So I'm glad that you did bring that up. One thing that you did mention is journaling. That's one of the things that I shared too, that I like to read and write. And when I can get by myself and just kind of write down my thoughts and process things that are going on, it's helpful to me, especially when you go back and look at something that you wrote maybe 6 months ago when you were just in the thick of whatever the crisis was, thinking, how am I going to get through this? And then you go back and see, well, I did get through that.
Absolutely. And again, we will get through this.
Yes, we will.
That will happen. And journaling is also a great way for your children to process some fears, some anxieties that they may have. And even if they can write some things down or engage in some play activities with you while to explain how they are feeling, I think those are very good ways for children, or very healthy ways for children to discuss what's going on with them.
Yeah, and they can even draw if they,
Absolutely.
They can't write
Yes.
very well yet, depending on their age. The pictures are helpful.
Are
as
very
well.
helpful.
And we have some people that are pretty engaged. Kat says FaceTiming with loved ones is also good.
Extremely.
Yeah.
Extremely. Again, social media, there's a lot of talk about how social media can be bad for you, but this is one of the times where it can be very helpful.
Yeah.
FaceTiming, Skype, there are so many other apps that people can use to connect.
Yeah.
Again, connecting with people even virtually lets you connect with them. You can check in on your loved ones. You can just have that sense of bonding with people.
Right. And I talked about that too a couple of weeks ago. Everybody knows I have a little grandson. He's not 2 yet, and I miss him so much. I can't hold him, so I try to FaceTime him every other day. And he knows who I am. When I come on the camera, he gets all excited and yells. But I agree, it's not the level of human interaction that we want to have, but it still allows us to have that human interaction. And
Absolutely.
we need to do that.
Yep.
So.
And my parents are in India. I have no family in the United States. So with my family being in India, that's my way of connecting with them, is to make sure that they're safe and they're healthy. My only caveat to this is, if you have children who are on social media, you definitely want to monitor their activities on social media. Teenagers may not like it, too bad. But as a parent, you absolutely want to monitor every single thing that they're doing on social media.
Absolutely. What are some things that listeners can do to reduce stress and boost morale for themselves and others? And I think we kind of been talking about that. Let me see if we had any other. Oh, Patricia says silver sneakers videos for the elderly. I am not familiar with that.
Yeah, neither am I, actually. I would like to see it.
Okay,
for sure.
Patricia, you stumped us, so we're going to have
Yes.
some homework to look that up. I haven't heard of that. Rebecca says, is there a number we can call? Okay, we'll get to that. We'll get to that. Okay. If a listener or someone they love is experiencing a mental health crisis during this time, what are the steps that they should take and what resources are available?
I think the most important thing during, if you are having a mental health crisis, is to reach out. That is the most important thing.
So contact your doctor.
Contact your doctor. Doctors' offices are still open. They are still having visits. You don't have to be there in person. I'll give you an example. At Riverside, we are having video visits right now with patients. We're also having telephone visits. So contact your doctor. However, in the situation that the clinic is closed, there are other ways that you can reach out. Let's not forget, if you are having thoughts of suicide, 911 is still your go-to number. Someone always answers at 911, right? Christmas, Thanksgiving, snow, rain, coronavirus, right? Somebody will always answer. And mental health crisis or having thoughts of suicide is an emergency. A lot of people don't realize that. You know, if you start having chest pain, yes, you will call 911. And so people also need to realize that having thoughts of suicide is also an emergency. So absolutely call 911. If you're living in town, Riverside also has a central intake department that you can call. It is staffed 24/7, and their number is 844-442-2551. And if we can post that on the website or on the Facebook page, that would be a good number to have. That's in our community.
Can you repeat that for us again?
Yes, it is 844-442-2551. It is the Riverside Central Intake Department. It is only for mental health,
Is
this
that
number.
24/7?
It is 24/7. Any day, any time, someone will answer your phone call and will direct you to the appropriate place, right? If your crisis is such that you cannot wait for help, they will direct you to come to the emergency room. If they feel that you can, that it can be an outpatient situation, they will, again, refer you to the appropriate resources.
So if I'm not to the point where I feel suicidal and I don't have a primary care physician, would that be the number that you?
Absolutely.
Okay.
Call that number.
Okay. Because we know everybody doesn't have a primary. We want everybody to have a primary care physician, but we know that everybody does
No,
not.
absolutely call the central department and they will help you.
Okay. All right. One of the things we shared yesterday during my video update, the state of Illinois has established a number as well. It's called, it's a call for calm. Call the number 4 and calm. Free emotional support service for those experiencing stress and mental health issues related to COVID-19. So if people have a cell phone, they can text TALK it would be 552020, and if it's a Spanish speaker, they would text hablar, again, 552020. But locally here, we have the 844 number you just provided for the hospital.
Absolutely. And again, let's say you don't feel comfortable, reaching out. The National Suicide Hotline also has a chat feature, an online chat feature, where you can chat with somebody live in person. They also have a phone number if you prefer to call, and that's the National Suicide Hotline. It's 800-273-8255, and that's the National Suicide Hotline number that you can
repeat
have.
that again.
Yes, 800-273-8255.
Okay, that's the National Suicide. So the next question asked about the Riverside Central Intake, which we already talked about, but we had a couple comments come in. Anthea says, work on projects such as business ideas or blueprints to prepare for after the pandemic. And that was one thing you mentioned, and that's something that I've been telling my community too when you talk about reassurance. We are in times we have never seen or lived through before. And a lot of uncertainty, a lot of fear that makes people more anxious. But we will get through this.
Absolutely.
We will be on the other side of this.
Absolutely.
We just don't have the date yet.
Right.
But it's coming.
And I think that's why it's important to engage with your community, even if it's virtually, right? Because it kind of helps you have that support system.
Yeah. And I like what Anthea is saying about projects, because then you're planning for the future.
Yep. All the things you put off doing, you
Yeah.
know, it's the time.
And then Kat says, music is good for the soul. Yes, ma'am. What's your favorite type of music? So I'm going to ask you, Doctor.
So I'm going to I know people are not going to like this. I love Taylor Swift. I also like Britney Spears a lot. But I grew up in
Who would have known? Who
I
would have
know,
known?
but I grew up in a very strong Methodist home. So all the hymns, I think those are my kind of comfort zone, so to speak.
Okay. But your fun music is Taylor Swift
Taylor Swift.
and Britney Spears.
I draw the line at Justin Bieber.
You don't like?
Now that's my
Oh.
no-no.
That's your no-no?
Yeah.
And for me, I think people know I love house music. I love Earth, Wind, and Fire, the 90s R&B,
Yeah.
good music. So, yeah, music is good. All right, so we already have someone that's posted the number in the comments for Riverside. Caleb, thank you. He's awesome. Any tips for caregivers or parents for younger children and teens? Any tips for those caregivers and parents?
Absolutely. I think the most important thing is to let them know what's going on in a language that they can understand. I think kids really want to know. If you're going to lie, kids are going to catch on. You know, they really are. And I think it's also very good when you're communicating with children to promote the sense of altruism. Almost, right? You want to tell them, you know what, hey, being at home, being in quarantine you're actually helping others by not getting others infected. I think, just having them also participate in this entire situation. Again, like I said, children are going to come and ask you over and over again. They're going to ask the same questions, and that is their way of seeking reassurance, and that's okay. The most important thing with parents is patience and reassurance, and that can be hard sometimes, especially when you're trying to work from home.
Yeah, yeah. One thing parents may not realize either, is it okay for a parent to admit to their child that they're scared?
Yes, absolutely. It is okay to admit that they're
talk about
scared.
that.
Yeah, I think it is. I think parents need to be honest, right? It's okay to admit that you're scared, but to let them know, hey, mommy and daddy are going to do everything they can to keep things safe, like we are going to wash our hands frequently, right? We are going to cover our faces when we go out. So you want to tell them the concrete steps that you're actually taking to keep them safe and to keep themselves safe. A lot of kids are also worried that their parents may get the coronavirus and may die, or actually have got the coronavirus, right? What do you do in that situation? Again, being honest, right? Is, hey, mommy has or daddy has this infection, but the doctors are doing everything they can to keep them safe. They're getting medicines, and I think those are some of the things that you want to definitely address with your children when something like that happens.
Is there anything else that you believe our viewers should know?
Again, like I said, this will get over. This will get over. The other thing I definitely want to bring up is, don't delay. If you are having a medical issue, I'm not just talking about mental health. If you are having a medical issue and you need help, come to the hospital before it's too late. What I'm talking about is not just respiratory. Let's say you have some weakness in your legs and you're worried that you may be having a stroke. Come to the hospital. People are very afraid of going to the hospital right now. I just want to let people know that we are taking all the steps to keep people safe. I think right outside the emergency room there is a big tent where if you are having any respiratory symptoms, you are separated. So the emergency room is kind of dedicated to people who are not having some respiratory symptoms, or we are isolating and taking all the steps to make sure that people don't contract or spread the coronavirus.
I think that's a very good point. Many people are afraid of hospitals and doctors anyway, so you're saying...
And I'm not scary, right?
You're not scary. No, you're not. But you're saying that you all have taken the precautions at Riverside to keep people who are experiencing respiratory symptoms separated from other people who may have other
Absolutely.
issues that warrant emergency care.
So we are taking all the steps, that are needed. We understand that people are anxious, but we don't, because we've had cases where, people have come to the hospital a little bit too late, and we don't want that to happen.
Right, right. Kat says, thank you for all this information. It's much appreciated. You are very welcome.
Very welcome.
Very welcome. We are so happy to be able to connect with the community and share and then get your ideas as well. People share a lot during these sessions, so it's helpful for everybody. Patricia is giving us the update on the Silver Sneakers. So she said, Silver Sneakers has exercise programs for those over 65.
Oh, wonderful.
Chair stretches, low resistance, low impact, and more. Many gyms are doing free online classes now for a period of time. So, Patricia, we just learned something today. Thank you so much for sharing that with us.
Silver Sneakers.
Silver Sneakers.
And again, exercise not only is very good for your physical health, but it's great for your mental health. You know, it's a big stress reliever.
So as the mayor of the city, when we have incidents happen, of course, I get the calls. And so the city of Kankakee, you know, we have an urban feel. So, you know, we have some crime in our community, and we've had that for years since I was a kid here. But I have noticed, and I have been concerned about situations now, particularly related to like domestic violence.
Absolutely.
Or we had a family the last couple weeks, and it's you know, when we've had our incidents with some of the other types of crime, like gun violence, it's been our younger males. And then we've had a family where it's actually older women that are older, and it just seems that people are just, because they're together more, they're starting to just have conflicts, and they're fighting, and you know, those types of things. So what can we do to support those families? So if I'm not, let's say I have a brother and we, you know, before Corona, we live in the same house, but, you know, we kind of go our own ways. We work different shifts. We don't see each other that much. But now that we're, you know, trying to stay in as much as possible to protect ourselves and others, we're having to interact with one another more frequently in the house, and it's leading to these conflicts. What would you suggest, and how can we support those families?
You're absolutely, I think I would actually take this a step further, right? I'm not just worried about victims of domestic violence. I'm also worried about children who are being abused.
Yes.
And I think this is the unintended consequences, right? The abuser is right in the home, and it can be very difficult. And with everything closed, victims really sometimes find it hard to reach out or seek help. However, I do want to let them know, right, the National Domestic Violence Hotline is still active 24 hours a day. You know, I think the number for that is 800-799-SAFE, S-A-F-E. That's their number. It's 800-799-SAFE, SAFE. I think the most important thing is reaching out to somebody, right? Because even our domestic violence shelter is still open in town. Yeah. And so it is very important to reach out. I think with everything, with the stay-at-home order, people feel as though nothing is open. But I do want to let people know that if you are suffering or experiencing domestic violence or abuse, we still have our domestic violence shelter open, and reach out. Even if you don't feel comfortable talking to the domestic violence hotline, reach out to a family or friend. I mean, just reach out is the biggest, I think, takeaway from this, really.
And locally, our domestic violence shelter is Harbor House, and they do a great job. I served on the board there for 6 years, and they have an amazing team of employees, and Jen is the executive director. I mean, they do great work. And so I'm glad that you mentioned that they are still available to people who need those services in the community. And I think that's very good to bring up, because that perception may be that these places where we normally can go get help aren't open, and they are. Right. They are still open. Child abuse. There's an abuser in the home. What do you suggest?
I would, if there's a child involved, again, definitely reaching out. 911 is, I think, your best option right now. Right. Again, in other situations, that would have still been the best option. But if you are virtually attending school, the teacher can probably view you, and there is probably a way to communicate with or notice injuries on a child. So this is for all the teachers out there who are actually
mandated reporters.
They're mandated reporters.
Correct.
And if there's any child or teenager who is listening right now, you can absolutely call 911 to kind of seek help.
Sherry says this was so informative. Thank you. You're welcome. She also shares Zoom is another good resource, not just to do business meetings. Schedule a virtual meeting with your families. It's like FaceTime. It can hold up to 100 people.
Absolutely.
And that is a great idea.
Yep.
My friend that I mentioned that's the mayor in Oklahoma, she actually reached out to several of us women mayors. We have a network throughout the country, and she scheduled a glass of wine and just,
right.
yeah, at 8 o'clock, it just catching up with one another and being able to connect. So I think that's a great idea to do that with your families. I know one of my friends for Easter, they did that with their family. They all got on a Zoom call because they usually have a big gathering and a meal together, and they, of course, couldn't do that. And so they utilized Zoom
So
to do that.
there's another app. I'm not, again, this is just personally.
We're not promoting
We are not promoting anything.
The other.
We are not promoting. I had one of my friends introduce me to an app called House Party.
House Party.
House Party.
I'm interested
It's
in
kind of the
that.
same thing, right? You can connect with multiple people at the same time, but you can virtually play games with each other, like an actual, like a trivia game, and so it's good. Again, not promoting.
Right.
But that's what I'm using personally.
It just gives us other options and for people to know what's out there. So that sounds fun. Okay. All right. What if people can't sleep?
So that's a big deal, right? I think you do absolutely want to reach out to your primary care doctor. So again, I want to tease this apart a little bit, right? Because people say they cannot sleep.
Take your time.
And so I'm going to tease this apart a little bit. So does that mean you have trouble falling asleep? You have trouble staying asleep? Is it both? Are you taking cat naps during the day? Right? Because if you're going to take cat naps during the day, guess what? The chances are you're probably not going to sleep at night, right? However, for people who really struggle with sleep, I recommend a few things. No caffeine after 12 p.m. Absolutely no caffeine.
Noon?
After 12 noon, no caffeine.
No caffeine.
No caffeine. If you are having trouble falling asleep, right? No caffeine after noon. There are all these new sodas that are coming out, right? Coke, Dad Zero, or, which promote no caffeine, but they still have a little bit of it, right? So you want to stay away from caffeine.
So that's colas, teas.
Chocolate at
oh,
night.
Oh man, chocolate.
Right? Chocolate.
No chocolate.
At night is pretty big. And so
this is a big deal, you
this
guys.
is a big deal. This is truly a lifestyle change.
This is like big, you guys.
Yep. And I'm guilty. I like my chocolate. And so having a schedule, going to bed at a set time, waking up at a set time. When you go to, your bed is only meant for sleeping. That is what it should be for, right? So it should be in a dark, cool place.
So no TV?
No TV, no phone,
No
right?
phone.
And we are all guilty. I'm guilty, right? At night you want to scroll through.
Yes.
And there's a scientific explanation for this, right? Why not? So the question is why not? And so if you go to prehistoric eras, right, there was no electricity, such a thing didn't exist. And so our brain actually secretes a hormone called melatonin. And melatonin is only secreted when it's dark, or like when the sun sets. And so the melatonin causes you to fall asleep. Now with your phone right in your face, or with your TV, your brain sees light.
Yes.
And so melatonin's not secreted.
So I'm doing a lot of things incorrectly,
Right?
you guys.
So,
I gotta get it together.
and this is hard. I get it. A lot of people are like, I need the TV in the background to like help me fall asleep. But actually your quality of sleep is probably not the best with that. And so let's say you fall asleep and you are not able to fall asleep within like 15, 20 minutes. Get up, go to a different room, walk around, do something else. Don't just stay in bed and like toss and turn and think about what you're going to cook the next day, for
So
example.
if you don't fall asleep within 15 to 20 minutes, you need to get up.
Get up, go to a different room. Not just get up and sit there, right? Go to a different room. And so at night, that's what you want to do. And so these are some of the sleep hygiene issues that we have. The other part truly is if you are, a lot of people will have this sense that I did not sleep at all at night. However, your spouse, your partner may be telling you, well, you were snoring away to glory, like it's like you really did sleep well. So the question truly at that point is there something wrong with your sleep architecture? You know, do you have sleep apnea or something else? So definitely reach out to your primary care doctor. We also, at Riverside, we have a big sleep clinic, really, and they really help address some of these things, because sleep, I think that is our biggest challenge right now, right? It's almost like an epidemic in America.
Right.
Is difficulty with sleeping.
Yes, it is.
Sorry, I went off base.
No, this is great, because I have a TV in my room, which I could do without a TV in my room, but I have one. I keep my phones on the nightstand, both of them, 2 phones. I know people work in their beds, they're on their laptops.
Absolutely.
What about reading in bed?
Same thing.
Writing in your journal in bed?
Same. The main reason why that is
because of the
recommended
light.
is not just light. Like, people will find their thoughts go over. It keeps your brain active,
Okay.
right? So if you're scrolling through social media and you see a post that you really don't like, or it's really causing you a lot of grief, right? What happens? You get so worked up, right? Your thoughts go over and over and over
Okay.
in your head. And so it's the same thing with reading. And so that's why it's recommended that you really don't engage in those activities, because the point is to get your brain to calm down. So it's very good to have a structure to your sleeping time. So it kind of tells your body that you're about to go to bed, right?
Okay.
Take a shower, just cool down, like dim all the lights, those kind of things. So your body kind of realizes, hey, I'm going to go to bed. No eating at least an hour before bed.
No eating an hour
Right?
before
No
bed.
eating an hour
so
before
the
bed,
bowl
so-
of ice cream in the bed, no.
No chocolate.
With the
I'm guilty of
chocolate
that.
chips.
I
The
like
mint
my chocolate at
chip
night.
ice cream.
Oh.
No,
Never tried that.
it's good,
It's good.
but not in bed.
Not in bed.
Not
Nope.
in bed. All right, you guys, we got some work to do. Is it important to have a routine or try something new? I'm asking for parents who have their children at home due to school being out. So kids, of course, we all were kids and we all wanted to stay up late, right?
Yep.
No, we don't have to go to school tomorrow, so why can't we just stay up late?
Extremely important to have a routine, right?
Extremely.
Extremely important to have a routine. And I understand it will be hard at times, right? It is going to be hard. So let's just acknowledge that, right? It is going to be hard. But yes, having a routine really helps, because what's going to happen when school starts back? Right? I mean, and so kids thrive on structure. They really do. Even adults thrive on structure.
That's true.
If you still have to work from home, get up in the morning, do the things that you would do if you were going to go to work, get dressed up. It really helps to have a structure. And of course, while you're working from home, your kids may interrupt from time to time, which is why I'm saying I understand it's going to be hard, but at least try some sort of structure.
Priscilla says this is very helpful. Georgia says, yay, Dr. Khisty. And Mary says, amazing doctor, and I'm honored to work beside him.
Oh, thank you.
Very nice. How long have you been here in our community?
This is my 3rd year.
What brought you to Kankakee?
So I wanted to work in an underserved area. That's my passion.
You wanted to work
In an underserved, like resource poor kind of region. That is my thing. That is my passion. Like, I live in Chicago, so I commute every day. But it's not like Chicago doesn't have hospitals, but I want to work in an underserved area. I think that's where I can make the most impact. If you go to Chicago, there's like Northwestern, and there's Rush, and there's Loyola, and all these places, and they don't really have a shortage of psychiatrists. But in Kankakee, we do. And our community, also, people like to be in their community and receive care in their community. It's not easy for everybody to drive an hour up north to go and see a doctor, and they shouldn't have to.
Correct.
And
so I'm going to tell you, like I tell everybody that says they're not, you got to move to Kankakee.
I should move to Kankakee?
You have to move. We got to get you down here. So you commute. So that speaks to your commitment and passion.
Yep. And this is my 3rd year, so I don't have plans of going anywhere. So.
Okay. Let's see, I heard another one come through. It always feels good to do something for others. How can this help people feel good if they are able to help someone out during this time? So
Most
April
important thing.
is Volunteer Month.
Yes.
And so what can we do to help somebody else?
Most important thing people can do to help somebody else is stay at home. Volunteer to stay at home. Seriously. Right? You're saving lives by staying at home. The other thing, if you do have to go out, wear a mask.
Wear a mask.
wear a mask.
What if I can't find a mask?
You can wear a bandana. You can just cover your nose. The point of wearing a mask is not that you will not get coronavirus. The point is that you won't spread it, right? Let's not forget, not everybody who has the coronavirus will have symptoms.
Right.
So you don't want to accidentally pass it on to somebody who.
So I can be what they call asymptomatic, a healthy person. I can have it, but I'm not having any symptoms.
Absolutely.
And so me wearing the mask is protecting you from me exposing you to it.
Absolutely.
That brings me to an interesting point when you say wear a mask. Black men may not feel comfortable wearing a mask, or young men. Particularly, we have a history in this country, and
Absolutely.
we all are aware of that. We keep it real here in the city of Kankakee. So, if I'm the mom of a young man, an African American male, and people are saying for him to put a mask on, and I don't feel comfortable, how do I reconcile that? How do I reconcile him maybe being mistaken for being perceived that he's going to do something that that he wouldn't be, interested in engaging in, but just because of his appearance. How do you reconcile that with keeping him safe?
Again, right now, I think wearing a mask is probably the most ideal, right? And of course, I completely understand what you're saying. It can be mistaken as something very different and can go very south very fast.
With a mask on, is he going to hold me up?
Absolutely, absolutely.
Yeah.
So maybe even cloth masks, right, are non-threatening in a way, or perceived as being non-threatening, or just covering your face with your shirt, or if you're going to sneeze, you want to sneeze in your shirt or in your elbow. However, if you still don't feel safe wearing a mask, maintain social distance. Easiest way, right? Maintain social distance. 6 feet away from each other, right? You're not wearing a mask, but you're 6 feet away from somebody, and so your chances of passing on or even contracting significantly go down, right? And for everybody, whatever race you are, try and avoid going out to start with. But if you absolutely have to and are unable to wear a mask, or there are valid concerns that you bring up, maintain social distancing. I think that's the most important way to prevent the spread of coronavirus.
Two things just popped in my head when you said that. So I saw something the other night on TV, and they showed somebody sneezing, and I think for some reason it was in my head that a sneeze will travel 7 feet. This sneeze, now you're the doctor, so I'm asking you. This person sneezed. They were doing a simulated, kind of activity, and the person sneezed. They were like in a grocery store, and they sneezed in aisle 4, and it showed it going to aisle 6. So it went 2 aisles, which is well over 6 feet.
Absolutely.
Can you speak to that?
So again, there are always going to be outliers, right? And so what studies have shown is that having that 6 feet distance you are going to prevent getting or contracting this virus if you're about that distance. Now, can there be other situations like you mentioned? Absolutely. There are always going to be outliers, right? Which is why the most foolproof way is to not go out, but that is not possible always.
Right. So with you saying that, I've been trying to share resources. We've been working really hard to put out as many resources as we can. So I just want to remind everybody, on the City of Kankakee's website, which is citykankakee-il.gov, we have a coronavirus tab at the top left corner. It's in red ink to stand out from the other tabs. And then we also have like a public service announcement where we put out, you can see all of our press releases that we put out. We share information, other press releases too, from like the Kankakee County Health Department on our social media. So I just want to remind everybody of that. But another tool I found out, actually my comptroller Elizabeth shared with me, and I'm not endorsing, but this is another one. It's called Shipt, SHIPT. And I'll spell that again, SHIPT. It's an app that you can download on your phone. It's $99 a year, so it's about $8.25 a month. But they will actually bring your stuff to you. So I actually
Right.
used it this week because I'm trying really hard to stay out of the stores. I don't want to get sick.
Yep.
You know, I'm the mayor of the city. I got to make sure that keep myself as healthy as I can. So they are linked with Target and Meyer locally and CVS. But they will actually, you can go on the app, shop, get everything you want, pay for it, and they will bring it to your house. So I told my husband, I may never go into a store again.
And I think you bring up a very valid point. There are a lot of grocery stores or even pharmacies who are delivering. I think the Riverside Pharmacy will deliver as well. So you don't actually have to step out of your home.
Right.
But this is the most perfect time to actually talk about our local restaurants and local businesses, right? A lot of them are delivering. There are food delivery services like DoorDash or Uber Eats or Grubhub and all of those delivery apps. I think at this time we also have to support our own local businesses.
Absolutely. And I think our community's been doing a good job of that. That was one thing that people started right in the beginning when we went on the shelter-in-place order, encouraging people to buy gift cards from the local businesses and making sure that we still went in to support. So we have a good community in that way. We had a couple comments. Alonzo says, awesome. Kat says, parents need time for themselves. Put the kids in bed. And that is so true. And then someone else says, that's a good point. What about time for ourselves? This is a perfect time to work on something fun or try a new hobby at home. What are some of your favorite hobbies? So I'll let you answer that.
Oh, I love watching TV. I can watch anything that moves on TV, I'll be honest. I'm advocating no TV in bed, but I'm guilty of it. I really love TV. I don't know why. But the other thing I like.
Were you allowed to watch TV as a kid?
Well, my parents cut off cable, I think, in 9th grade, and that's probably why I really love TV now, because now I can watch TV. But I'm still scared of my parents a little bit.
That's good.
The other thing I think is I really like is listening to podcasts. And so people who also watch TV, like there's this show called The Office, and The Office, the two characters have started a podcast. It's called The Office Ladies. So I love listening to that podcast because it's like one of my favorite shows, and then I get to relive it. It's fun.
Okay. And one of my favorite, I really like to read. I love to read. And I do like to read in bed.
What are you reading around?
I just got a new book. I'm trying to think. I've gotten a couple. I haven't started a new one yet. I finished one about feminism recently.
Serious?
It was so good. It was really good. It was like tapping into the superhero part of being a woman. So
that's good.
So
and so,
it was a good book.
talking about hobbies, I think, like I said, watching TV shows or reading books, I think it's very important to not watch, or at least that's what I would recommend, things that are gory, right? Or more
Scary.
anxiety-provoking, or more scary, right? This is already an anxiety-provoking time. You don't just want to make it worse.
Right. So no books, reading books in bed. Okay. All right. Music is good too.
Yeah, music is Taylor Swift.
Taylor Swift.
Not endorsing.
Somebody asked, what about our mindsets? There's a lot of info that can keep us down or feeling depressed or anxious. Let's try to focus on the positive, right? Yes.
Yes, I think positive self-talk has a very, very big role in this, right? And what can actually help your positive self-talk is, of course, dialing down the media exposure. Right now, when you watch the news, it's only about coronavirus, right? And so having one or two trusted sources of, news every day, perfect, right? The Center for Disease Control or CDC website, the NIH website, I think those are factual and to the point, right? I think sometimes we just want to know what's going to happen next and what's going to happen next. And so you're watching the news all day, and yes, it's going to cause you to feel more worked up, more anxious. And so having positive self-talk is really, really helpful.
Yeah. Kat says, allow children to FaceTime with their friends. What about the kids who are missing their friends right now? They're used to being in school, and that is so true.
It is. That is why the situation is so hard, because they're not only, they're missing out on that social interaction, and, having those social bonds of friendship or even fights and arguments that happen at school are really important for a child's development, right? They learn how to share, they learn how to interact in socially appropriate ways. However, since that's not possible, absolutely, right? You want them to have virtual contact with their friends, at least for the time being, until schools reopen.
Yeah. And I want to give a shout out to the teachers, because I mentioned Mrs. DeLone. She and I grew up together, and she's just a wonderful teacher. And she'll post her little conversations that she has with her students. So she'll call and then she'll post it on Facebook. The whole bantering back and forth that they have, little cute conversations. But it means so much. I know for me, being a kid, I really connect. There were certain teachers I think we all connect with.
Absolutely.
We all, as a kid, have that one or two, or maybe you're lucky and you get a third one. But teachers just play such a huge role in our kids' lives, and we need to celebrate them and thank them, because especially during this time, because again, this just happened so abruptly. They didn't have time. I mean, they just immediately had to adjust. This is an adjustment for everybody. So we want to just say thank you to all of our teachers out there that are continuing to guide our kids and check in on them and look after them. Cherry says she likes watching game shows. I know we have some Family Feud.
Oh my God, that's me. Game Show Network at night.
Erlene said comedy is great. Yeah.
Comedy is wonderful.
Comedy is wonderful. So we are wrapping up. We're coming down to our last couple minutes, but I just want to thank you again. This is Dr. Raunak Khisty from Riverside Healthcare. We appreciate you taking the time.
Thank you for
I know
having
you're very busy as a doctor.
No, thank you for having me, right? Anything we can do to help the community.
Yeah, and again, I want to give a shout out to Rebecca Parks, who works at Riverside. She invited me to speak for Social Work Month, and then we had a conversation about having someone come and talk about mental health. And again, mental health is important every day.
Absolutely.
365 days a year, not just during a pandemic, but especially during these times. We wanted to make sure that we had an opportunity to have a conversation about mental health. We will continue to provide updates. I did not have a video session on Sunday because it was Easter. And so we did one, I believe, yesterday, and so we will continue to bring updates. I want to make sure that you all are getting accurate information. I think Dr. Khisty talked about that. There's so many people talking about this on the news all day long, and my sources that I go to locally are Riverside Healthcare, Amita St. Mary's, and our Kankakee County Health Department. And then at the state level, it's the Illinois Department of Public Health. And then nationally, we're following the CDC. And so I want to make sure that you all know that there are reputable resources for you to connect to in terms of getting data and best practices.
Yep.
One of the things I want to mention again is that not everyone is passing away from this disease, but with that being said, I want you to understand it's still very important for us to follow the health guidelines. When we wash our hands, 20 seconds. If you got to sing a song, do it.
Absolutely.
And make sure I see people wash their hands like this. If you watch people in a bathroom or public restroom, but you want to make sure you wash your hands, get your, your nails, the backs of your hands, your wrists.
Absolutely. Those are all important areas.
All important areas. You want to make sure you do that. And the social distancing is so important. We are being separated, but we're standing together to protect human life. And so it's important that we continue to social distance. So I want to thank you all for tuning in with us today, and we will see you at our next video update.